Hi guys, my name is KP Bal, and as some of you guys know me from my previous videos, I'm a clinical tutor and I'm also a registrar here in Australia. So I thought, why not talk about 5 tips to pass the clinical exam as to what you should do and what you shouldn't do while you're preparing for your exams. So today, now again, I'd like to just disclose that these are just based on my personal experience and how I passed the exam. And I am quite proud to say that I did pass the exam in my first try, and I did put a lot of effort into that. Now, before I do continue, I'd like to encourage all of you guys out there, please do like my videos and subscribe to my YouTube channel, as this really does motivate me to put more videos out there and get more content out there for you guys. And for all of you guys who have been subscribing and following me, thank you so much. And let's start. All right. So, 5 tips to pass the clinical exam by C'est moi. All right. So, let's talk a little bit about clinical exam. So, as you guys know, the clinical exam is a very subjective exam, unfortunately. So, what that means is that it depends how you score, it depends on the examiner of the day and of that station. But however, there are parameters that do protect you, that if you do say or and you follow, they have to give you the marks. And if they do fail you and you feel very confident, you can definitely appeal for the case. So that's very important. So let's start with the first tip on what I did when I was preparing for the exams. So the first tip would be practice, practice, practice. All right. And now it's just not enough to just practice all the recalls and the stems that you have seen in the last 6 months to 1 year or even 2 years. What it really matters is when you practice, what are you practicing? So, for example, the differential diagnosis. As many of you guys have noticed, in my Instagram and my Facebook, I do post a recall of the day and I ask, what is your differential diagnosis? And this is very important because the differential diagnosis that you're coming up is just based on the stem that is given to you, which is a very little bit of information unless it's a psych case. And you have to come up with appropriate differential diagnosis within the 2 minutes to ask the role player about it. And that is a huge task to ask because in those 2 minutes, you're panicking, you're anxious, you're frustrated, you are just tired from all the practice and the studying. And you know what? It's not that easy for it to come to you that fast. So that's why when you do know the recalls, practice doing the differentials. So if I always practiced about 8 to 10 differential diagnosis per stem. And then when I went for the exam, oh, I have really bad panic attacks. Um, I actually was able to come up with 3 to 4 or even up to 5 for some stations, even in the nervous wreck of a person I was. All right, and state I was in. So that's one thing. Then history. History is very important to practice. Why is that important to practice? Because organization of the history is very important. Not just blurting out anything and everywhere. You get confused during. You have no idea if you've asked. You waste time and you ask questions that you've already asked in the past and you don't really get much out of the case. So that is one way. Another thing, if you stay organized, you also calm your nerves because you become confident and that goes a long way. And last but not least, PE. So PE is very important because again, you have to stay organized. All right. You must know the correct techniques for face-to-face exams. For online exams, practice saying them in layman terms for the parent or for the students. Not for the students, sorry. For any layman, for students, for medical students and interns, and for other medical doctors, it's okay to use the medical jargon. And that comes a bit more easier to us because that's what we've been practicing for all this time. So I would also, so what I did was I practiced it with my husband, who was in the healthcare but not in medicine. So he stopped me every time I used the medical jargon, and that went a long way during my exams. Now, what is the second tip of the day? So, second tip of the day, it's kind of touching base with my first tip, is to stay organized. So, one way to stay organized is look at the tasks. Stick to the order of the tasks that is asked in the STEM. All right, it's a good way to guide you. And then history. Always have a format of how you would approach. Now, I know that there are a lot of tutors out there and there are a lot of notes out there, But follow one and pick that one. Be very familiar with that one. Practice with that one and know it very well. All right. And organization is very important because that's how you stay calm. All right. And that goes for same for PE. And last but not least, the management. And management is a bit more easier because you have a sequential order, and I usually follow the Robbins. I don't know if you guys know the textbook Robbins. I loved it. So and also all the medical textbooks. I like to go with first the problem differential diagnosis, explain the risk factors and the complications, go to the investigations, and then go to the management, and then last but not least end it with the 5 R's. And that's my approach. And that's, see, I have a format, I have a way I've organized it, and that's something that's comfortable with me, and I've practiced for years, and I teach my students as well. So that is very important. All right. So let's move on. And we have the third tip of the day, which is recalls. No matter what it is, you must familiarize yourself with the recalls. And I would generally say it's about 6 months recall is really good. And if you have more time, you can go up to 1 year. I did about 6 months recall, and knowing these recalls are very important because you get similar cases. But again, do not memorize the recalls because they do change the recalls, and the diagnosis and the probable diagnosis varies just by changing a symptom or a sign or two. All right. So that is very important. The other thing about recalls is that we all come from different countries, and we all come from we have our own experiences, and we having treated and practiced and seen different kinds of diseases, and the diseases that you see in your home country are different from what you see in Australia. So it is very important that you familiarize yourself with the diseases here, and that's the first thing that comes to your head, and that can only be done if you familiarize yourself with the recalls. All right. So, fourth tip of the day is communication. This is very important. Why is this important? Well, what happens after you finish the AMC Clinical exam? You're going to practice as a resident medical officer or an intern or whatever position you get, even as a GP. It's very important. You must be able to build rapport with your patient. You must be able to engage with them. And this is important not only because for the exam purposes, it's because that's what you are when you're a doctor. You get the best out of the patient and the most out of the patient so you can treat the patient the most optimal way. And that is very important. Empathize with the patient. They are going through a tough time. They're at their most vulnerable state when they come to you. And this is very important. If you're unable to communicate with your patients, you're not going to be able to communicate with them in real life. And that's why they put so much of stress into this. Last but not least, reassurance. Reassure the patient. When you're vulnerable, you like someone coming to you and saying, "It's okay. Don't worry. We've got this." And that's very important. And communication is very important for a couple of reasons. One, to be a good doctor. Everyone knows that. Two, in business point of view, if you're going to be a GP, you need your patients to come back for a viable business. Three, you need to you need empathize with your patients so that they feel a connection and also you're able to treat them well. So communication goes a long way. All right. And also communication is important if you're planning to specialize. And last but not least, my fifth tip would be routine, routine, routine. And this kind of goes in hand with organization. So I love routine because it helps me calm my nerves. And when I mean routine, I don't mean about how to organize history, physical examination. No, 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 no. What I mean is before my exam, I have a routine. Actually, before I sit to study, I had a routine. I get up, I have my breakfast, I took a shower, and I watched TV for half an hour just to clear my brain. And then I would start at a particular time and I would end at a particular time. After I end, I have a bit of a break where I watch TV, a particular show for a bit of time, and I have my lunch. And I make sure I enjoy my lunches because I am a big foodie. And last but not least, I go and then again, I plan for the next session. So that's kind of a routine that I had developed as I was preparing for the clinical exam. And I know a lot of you guys out there have other responsibilities. So it's really good to have a routine in place so that it becomes second nature so you get your studying done. Especially moms out there with kids. It does go a long way, and that's how I get most of my stuff done now. I have a 1 year old. You guys have seen her in the previous video. That's how I get my studying done, me getting to work. I have presentations due for my work, so things like that. Last but not least, please avoid burnouts. It's so important to avoid burnouts because if you burn out just before the exam, you just can't give your 100%. That is very, very important. Okay. I hope these tips help you, and I hope you're able to understand and see where I'm coming from, and hope this helps you for your exam prep as well. If you want to talk to me and get some comments and feedback and even just get some advice, you're more than happy to contact me through my Instagram or through my Facebook group. It's the best way to contact me. I usually reply within a day. Um, and if you want to watch more videos, please do subscribe to my YouTube channel. Leave some comments in the comment section below about regarding other videos that you'd like me to make. I will definitely get on it. I am prepping one for the GP exam prep one. And also, if you have any further questions, don't hesitate to ask. It does help everyone around you, and I will definitely try my best to help you. All right. So take care, and I hope these tips help you. Bye.